ব্রেস্ট মিল্কের কি কি বেনিফিটস আছে। ফার্স্ট, nutritional superiority. Okay, it provides the nutrition necessary for growth and development of neonate or the period from birth to 6 months. Then carbohydrate, main carbohydrate is lactose and galactose. Lactose, the quantity 6.7 to 7.8 gram per deciliter. It helps to absorb calcium and enhances growth of lactobacillus. Lactobacillus is good bacteria. Then galactose form galactocerebrosides. Then protein, quantity of protein 0.9 to 1.1 gram per deciliter. The quantity is higher in preterm babies. It almost 1.8 to 2.2 gram per deciliter, and it is mainly consists of lactalbumin and lactoglobulin. Then it contains taurine and cysteine, which is necessary for brain growth, and it is lacking in cow milk, also lacking in formula milk. Okay. Then fat. Breast milk is rich in polyunsaturated fatty acid, which is necessary for myelination of neural tissue. It also contains omega-2 and omega-6 fatty acids, which helps in synthesizing prostaglandin and cholesterol, and this is necessary for synthesizing steroid hormones. Then HMO or human milk oligosaccharides. These are prebiotics. Prebiotics is helpful, and prebiotics are non-digestible carbohydrates. Okay. Then it also contains vitamins and minerals. Water, 88% water. This is important for MCQ purpose also. Okay. So breast milk contains large amount of water. 88% of breast milk is water and electrolytes. Then immunological superiority. এটা কোশ্চেনে এসেছিল, ঠিক আছে। তো ব্রেস্ট মিল্ক কন্টেন্স secretory IgA, immunoglobulin A, then macrophages, then lymphocytes, lactoferrin, lysozyme, bifidus factor, interferon. Okay. So this lactoferrin has antiviral, antifungal properties. Bifidus factor provides protection against E. coli, staphylococcus. Okay. Then breast milk is also helpful for mental growth. And what are the benefits of breast milk to mother? Uterine involution. Uterus returns back to its normal position quickly. Then it reduces the risk of postpartum hemorrhage and lactational amenorrhea. During the period of lactation, there are very less chances to conceive. So this is lactational amenorrhea. So these are benefits to mother, and above all these benefits are benefits to baby. Now composition. Comparison between human milk and cow's milk. Protein. Quantity wise, cow's milk is superior. More protein, 3 gram per 100 ml. And in human milk, it is 1.1 gram per 100 ml. Okay. In human milk, the casein is to whey protein ratio is 40:60. Okay, whey protein quantity is more. And in cow's milk, casein is to whey is 80:20. So in cow's milk, casein protein is more in quantity. So quantitatively protein is more in cow's milk, but qualitatively human milk is more superior as it contains more whey protein. Then lactose is more in human milk, 7 gram, and in cow's milk 4.5. Fat almost similar, calories almost similar, 67. Okay. Sodium is less in human milk, 0.7 milliequivalent. So human milk has less solute load, which creates less pressure on kidneys, because In newborn, kidneys are immature. Okay. Osmolarity, it is also less osmolar, 7.9 milliosmol in human milk, whereas cow milk, it is almost 3 times, 22.1. Okay. Now, what are the contraindications? Very less contraindications. Okay. If mother is on antithyroid drugs like carbimazole, methimazole or any anti-cancer drug, then breastfeeding is contraindicated. Then intake of drugs like any radioactive compounds or lithium, and if baby is suffering from galactosemia. So, these are the contraindications. But HIV, tuberculosis, hepatitis B in mother are not contraindications to breastfeeding. In Indian scenario, infants are very much dependable on breast milk. So, these even HIV, TB, hepatitis B are also not contraindication to breastfeeding. Breastfeeding is allowed in these conditions. Okay. This is anatomy of breast. So, these are glands, okay, from where the breast milk is secreted, and surrounding the glands there are muscle cells or myoepithelial cells. These muscle cells contract and helps to expel the breast milk through the ducts. These are smaller ducts join to form larger ducts, then larger ducts join to form lactiferous sinuses. When these lactiferous sinuses are compressed between the infant's tongue and palate, then milk comes out through nipple. Okay. So, this is the basic anatomy of human breast. Prolactin reflex. Prolactin helps to secrete milk, and oxytocin makes these myoepithelial cells contract. So, oxytocin basically helps to let down the milk through these ducts and lactiferous sinuses. Okay. So, prolactin reflex, whenever breast suckling by neonate, baby suckling, then impulse will go to the anterior pituitary, because prolactin secreted from anterior pituitary. Then from anterior pituitary, prolactin will release, and prolactin acts on alveolar glands of breast. Milk production will increase. Okay. And another is oxytocin reflex. Whenever baby suckles, then sensory impulses from nipple goes to posterior pituitary. Prolactin secreted from anterior pituitary, oxytocin secreted from posterior pituitary. So, impulses from nipple goes to posterior pituitary, then impulses will release, as a result, oxytocin. This oxytocin helps to contract the myoepithelial cells and to helps let down the milk. Also, baby's thought, sight or sound stimulates this oxytocin reflex, because for this, rooming in, the mother and baby in same room, presence of baby and mother in same room is very much important, because baby's thought, sight, sound will stimulate this reflex, and tension, stress, lack of confidence, pain, lack of sleep hinders the milk flow, because these conditions inhibit or prevent the oxytocin reflex. Okay. Now, mother will often complain of breast milk is not coming in adequate amount. So, insufficient breast milk. But what are the causes? First, delayed initiation of breastfeeding after birth. So, what will you do? Start breastfeeding immediately, as soon as possible. After vaginal delivery, and within 30 minutes after cesarean section. In both conditions, as soon as possible, we will initiate breastfeeding and early skin to skin contact. Then cracked or sore nipple. So, what will we do? Correct positioning and attachment of the baby with nipple and areola and apply hind milk to the nipple and areola. It helps to, it works as a moisturizer, okay, and it also has anti-infective property. So, that's why we will apply hind milk in nipple and areola, and oral analgesics for relieving of pain. Then supplementary feeding, avoid any supplementary feeding like honey or any outside food, okay. So, we will avoid any supplementary feeding. Infrequent night feeding. Night feeding is very important because prolactin is secreted more in night. So, frequent night feeding is also important. Then breast engorgement. Here correct positioning and attachment is important, and treatment we will give hot fomentation, okay, warm compress, then massage, then frequent breastfeeding of expression of milk and oral analgesics for relieving of pain. Frequent breastfeeding is important, otherwise breast milk will be collected in the breast and breast engorgement will increase. Maternal stress, will counsel the mother to reduce the stress. Any painful condition, specific treatment or paracetamol for pain. Then if there is history of less sleep, we have to ensure proper sleep and rest, okay, and keep neonate and mother together. That is rooming in. Rooming in is very important. The reflexes, 3 reflexes are there for successful breastfeeding. First is rooting reflex. Whenever something touches the neonate's cheek or side of the mouth, then neonate turns his head towards mother, opens his or her mouth and searches the nipple. First, rooting reflex. So, searching the nipple. Then, after getting the nipple, suckling reflex will be activated. Tongue presses the nipple and areola against the palate. Okay. So, not only nipple, both nipple and areola will be compressed between tongue and palate. These will squeeze the underlying lactiferous sinuses, which helps to come out the milk. And then swallowing reflex. Milk is coming out. Now, when the baby's mouth is filled with milk, it starts swallowing. So, baby will start swallowing. First finding the nipple, then squeezing the underlying sinuses, then swallowing. Okay. These 3 reflexes are important for successful breastfeeding. Now, when these reflexes appear or mature in 32 weeks, before 32 weeks, in 28 weeks, all these reflexes are absent. Okay. So, in 32 weeks, the rooting reflex weak and slow, sucking also reflex is weak, and swallowing associated with a pause in respiration. So, basically before 32 weeks, it is very difficult to initiate breastfeeding because these reflexes are not present. In 34 weeks, rooting reflex is present, sucking reflex is still weak, and swallowing less frequently, interruption of respiration, okay, when breastfeeding. In 38 weeks or term babies, all these reflexes are strong, rooting and sucking reflexes are strong, and swallowing well coordinated with respiration. There is suck swallow coordination. Okay. Now, composition of breast milk. Breast milk first contains colostrum. Colostrum secreted during initial 3 to 4 days after delivery. Okay. This is yellow and thick, but consumption of this colostrum is very important because it contains antibodies immune competent cells and vitamins A, D, E, K. Okay. So, it has immunological benefit. So, colostrum is very important. Don't discard the colostrum. Then after 3 to 4 days until 2 weeks, the milk is transitional milk. Immunoglobulin and protein content decreases and fat and sugar content increases. So, in colostrum mainly antibodies, immune competent cells. In transitional milk, fat and sugar content is more. Then mature milk, this is thinner and watery, water content is there in mature milk. And in preterm milk, as I said earlier, it contains more proteins, okay, sodium, iron, immunoglobulin, calories, okay, because preterm baby need more protein, more calorie, okay, more immunoglobulin. Then foremilk and hindmilk. Foremilk secreted at the start of a feed, that is foremilk. It is watery, water content is more and high in protein, sugar, vitamins and minerals. It meets the baby's thirst need, okay, as it is watery, that's why. Then hindmilk, it is rich in fat. It will provide more energy and sense of satiety, okay. So, it meets the baby's thirst and it meets the baby's satiety. Then positioning of the mother. Mother can assume any comfortable position, okay. She can sit, she can lie down, but her back should be well supported and she should not lean on her neonate, okay. So, this is position of the mother and the position of the baby. Baby's whole body is supported, you have to support the baby's whole body. Then baby's head and body are in one line. Okay, wait. So, these are the different posture during breastfeeding, okay. So, mother can sit, mother can lie down, okay, and mother's back is well supported, okay. And in these figures you can see mother should not lean on her neonate, okay. And what will be the position of the baby? Baby's whole body is supported, you can see mother is giving support to baby. Then baby's head and body are in one line, okay. For feeding, baby not only rotate his or her head towards breast, but baby's whole body will be turned towards mother, okay. Then baby's body turned towards the mother and baby's nose is at the level of nipple, okay. So, these are the positions or postures where mother can breastfeed her baby comfortably. These are common breastfeeding position. Commonest is cradle hold, okay. You can see the baby is getting breast milk from left side of breast and mother gives support to the baby's head with left hand, okay. Same side of breast and support with same side of hand. Exactly opposite in cross cradle hold. Here baby is getting breast milk from right side of breast, but baby's head is supported by left hand of mother, okay. So, this is opposite side. So, this is cradle hold and this is cross cradle hold, and this is football hold or rugby hold. This position is beneficial for twin babies, okay. One baby can suck breast milk from this side, another baby from opposite side. So, for twin babies, football hold or rugby hold is beneficial. Otherwise, most common position is cradle hold. These are laid back positions and this is side lying position, okay. In laid back position, mother will be propped up, mother will be in propped up position. Okay. Attachment also means latching. So what are the signs of good attachment? Baby's mouth will be wide open. Okay. Most of the nipple and areola will be in the mouth. Not only nipple, both nipple and areola will be in the mouth. Only some part of upper areola will be visible. Lower areola will not be visible. Okay. If lower areola is visible, then the attachment is not good or not proper. Then baby's chin will touch the breast and baby's lower lip is everted. Okay. So this is good attachment. Lower areola is not visible. Part of upper areola is visible. Okay. Baby's mouth is wide open and most of the nipple and areola are in the mouth of the baby and baby's chin touches the breast. So this is good attachment. And here only the nipple is inside baby's mouth. Lower areola visible. Okay. So even baby's chin is not touching the breast. So this is poor attachment. This is steps of breast milk expression, where expressed breast milk is important, expressive breastfeeding. So what are the steps? First, massage the breast gently towards. Next step is place the thumb and index finger opposite each other, like 12 o'clock and 6 o'clock. Then press back towards the chest. You will press back towards the chest, then milk will come out. And we will change the position of thumb and index finger, like first 12 and 6 o'clock, then 3 o'clock and 9 o'clock, and we will repeat the same process, like press back against the chest in different angle, and milk will come out. Now inverted nipples. First, this is flat nipple and this is inverted nipple. Okay. So flat or small nipples, which will be prominent on pulling out, not causes difficulty in breastfeeding, but from the antenatal period, pulling out the nipple and rolling it between finger and thumb is several times is important. Okay. It has to be done from the antenatal period. Then only latching will be good. Otherwise, latching will be difficult. Cut plastic syringe can be used. How? This is a plastic syringe. We will cut this portion and the piston will be inserted the opposite end, and it will be placed near nipple and covering the nipple and areola. Whenever we will pull out the piston, pulls the piston out, then breast milk will come. Okay. Most simple technique of coming the breast milk from inverted or flat nipple. Okay. Sore nipple. When neonate sucks only nipple. That's why both nipple and areola inside the mouth of baby is important. Incorrect attachment, then baby is unable to get milk and sucks vigorously, then bites on the nipple. That will cause the sore nipple. It is the most common cause. Another cause is frequent washing with soap. Frequent washing of breast with soap is another cause. But most common cause is this incorrect attachment. So treatment is correct positioning and attachment. Then breast engorgement. This is the figure, breast, engorged breast. Okay. Tense, shiny skin. You can see the inflammation also. Okay. So breast engorgement in delayed or infrequent feeding. Breast milk will remain inside the breast. Also in incorrect attachment or positioning. So breast become hard, tender, warm. Okay. So how to prevent? Early and frequent feeding, and treatment: hot fomentation, warm compress, massage, frequent feeding or expression of milk, and analgesics for pain. So frequent feeding is important. If breast milk gets collected, then breast will be engorged. Another one is breast abscess. If this breast engorgement, cracked nipple, blocked duct, mastitis, these are not treated in early stages, it will lead to high grade fever, malaise, breast inflammation. Infection will be there, abscess will form, then the only treatment is IND, incision and drainage, and analgesics for pain. So, what are the steps or components of successful breastfeeding? Just the summary of whole breastfeeding PPT. First, motivate the mother from the antenatal period, not just after delivery. Then start early, start as soon as possible, start breastfeeding both after normal delivery and after cesarean. Then rooming in, keep neonate and mother both in same room. This is important. Frequency, frequent feeding is important. Avoid prelacteal feeds like honey. Avoid bottle feeds, that will increase the chances of infection. And feeding from both breasts, it is also important. After completion of feeding from one breast, then we will go for feeding from another breast. Duration of exclusive breastfeeding, that is up to 6 months. Cleaning the breast and complementary feeds, that is after 6 months. So these are all components of successful breastfeeding. One thing we commonly miss, that we motivate the mother but after delivery. We have to counsel the mother and motivate the mother from antenatal period itself. Okay. Then human milk banking, for whom preterm and sick babies unable to get mother's own milk, okay, due to maybe separation from mother, or mother is sick that she can't provide milk. Okay, in adopted babies or babies whose mother have died in postpartum period, and in case of multiple birth, the breast milk production is not adequate for each babies. In this condition, human milk banking or bank has great role. Okay. And World Breastfeeding Week is 1st to 7th August. Okay. It is also celebrated here every year.